Okay, recording has started.
So good morning. Thank you for the invitation, Patrick. First of all, let me just say one statement about myself. I'm a graduate of the Master in Hospital Administration from the UP College of Public Health in 1991. Today, I was asked to give a lecture with this title, Systems Thinking in Healthcare Facilities for HA202, with the following prescribed learning objectives. Number one, understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Number two, understand the importance of alignment and integration. Take note of these two important words in managing a hospital and its departments. Number three, describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And number four, discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. With these prescriptions given to me by the course director, I shall delimit my presentation on health facilities to the hospitals with focus on a department, since this is the content of our course department, okay, rather than on the whole hospital. Thus, I will change my title then to Systems Thinking in Hospitals with focus on departments, so that I'll be aligned with the learning objectives that I just enumerated. Let's start with the structure and basic functioning of the hospitals. All hospitals are made up of so many different departments and services. And we look at the hospitals as a systems, that is a set of interrelated but separate parts working towards a common purpose, objectives, or vision, or goals. As hospital managers, we must know how to manage the hospital effectively and efficiently by making sure that all the various different departments, and there are many of them, and services are aligned and integrated in their governance and functioning. Again, the keywords here, aligned and integrated. Systems perspective, system approach, and system thinking are many terms or various terms that one will encounter in the management discipline manuals and internet, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of the various interrelated parts of a system. Suffice it to say that systems perspective or approach to the management views the organization or the hospital, we're talking about hospital today, and also the department of a hospital as a unified, purposeful system composed of interrelated parts. This perspective or approach make the manager sees the organization as a whole and as part, at the same time, as part of the larger external environment. And systems thinking, on the other hand, is a holistic approach to analysis that focuses on the way that the system's constituent parts interrelate and how the systems work over time and within the context of a larger systems. Put it in another way, systems thinking is basically a way of helping a manager to view the systems from a broad perspective that includes seeing the overall structures, patterns, and cycles in the systems, rather than just seeing the specific events or incidents or problems in the system. The broad view can help the manager to quickly identify the root causes of issues in the organizations and know just where to work to address them. Systems perspective, approach, and thinking are management disciplines that are concerned with an understanding of the system by examining the linkages and interactions between and among the components that comprise the entirety, the wholeness of that defined system. So we're talking about the hospital and also the department here. The bottom line of systems perspective, approach, and thinking is the recommendation for all managers to view and analyze situations, if there are problems, situations in the hospital and the departments, holistically and comprehensively, and to always look at the interaction of parts to other parts as well as to the whole, and vice versa, and alignment and integration as key results areas and key performance indicators. So what is alignment? I said this is one of the keywords that we have to remember. Alignment means the state of consistency among the plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis that support the key organizational-wide goals. So this definition comes from the Baldrige Healthcare Criteria for Performance Excellence. Alignment, to amplify, alignment means consistency between all hospital plans and hospital goals. So we're talking about the system consisting of the whole hospital and departments, not only one department, but the various departments within the hospital. So the goals of the departments and also the goals of the hospital must be consistent. Consistency between the department plans and department goals, that's one aspect of the word alignment. Consistency between the department plans and with that of the hospital. It also means the quality of doing things toward the same direction. Thus, to be aligned, all staff should be clear about the hospital's purpose and policies and procedures, as well as those of the department, and make decisions in accordance with them. And then what is integration? Integration means harmonization of plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis to support the key organization-wide goals. Again, this is a definition coming from the Baldrige Healthcare Criteria for Performance Excellence. Integration means harmonization between and among all the parts of the hospital and departments to produce a unified outcome and goal of the hospital, not only of the department. So it is said that effective integration goes beyond alignment and is achieved when the individual components of a system operate as a fully interconnected unit, such as the harmonization of music by an orchestra. In effecting harmonization and integration, it is implied that the coordination, which means synchronization, and collaboration, the other term for that is cooperation, of the parts are very, very important. So this slide shows or illustrates the concepts of alignment in number 3 and integration in number 4. The ultimate target is an integrated approach or integrated process in number 4. Number 1 illustrates the complete absence of uniform or consistent direction of the arrows, which which is equivalent to the processes in the hospital, all going into different directions. So this is the phase in which the organization is just reacting to problems. Number 2 illustrates some amount of uniform or consistent directions of the arrows and processes. There are some tendency to go to the same direction. This is an improvement of the first phase. This is the phase of the early systematic approach, which should be further developed into alignment in number 3, and eventually integrated approach. As I said, the ultimate target is integration. As mentioned earlier, in effecting harmonization and integration, coordination or synchronization and collaboration or cooperation of the aligned parts are very, very important. This slide shows the alignment on the left side. Then, with coordination and collaboration of parts, integration is achieved. So these are the keys to the performance excellence of hospitals. So back to system thinking in hospital with focus on departments. As mentioned earlier, all hospitals are made up of so many different departments and services. The number varies from one hospital to another. The minimum number will be one imposed by the Department of Health licensing body. This is the Philippine Department of Health. If there are international students from Malaysia, you can call it the Ministry of Health. So it all depends on the system in your country, but I'll be talking about the Department of Health in the Philippines. So in the Philippines, we have the level 1, level 2, and level 3 types of hospitals. Level 1, this consists of the basic departments and services. And level 2, there are medical specialties, but without training program, thus with more department and services than level 1. In level 3, there are medical specialties, but this time there are training departments. Thus, you have more departments and services than level 2 and even level 1. Examples of hospitals, hospital departments and services. Number 1, I just categorize it this way. Medical services department, such as emergency room or Department of Medicine, emergency medicine, outpatient department, inpatient department. The other category are the diagnostic departments, laboratory medicine, radiology, nuclear medicine. Then treatment departments, which consists of the following, which could be more. This is just a partial list: operating room complex, OB/GYN complex, rehabilitation medicine department, medical specialty departments like the internal medicine, surgery, orthopedics, anesthesiologists, etc. Then you have the nursing service and also the dietary department. Another category of the hospital departments and services, you have the medical support departments, you have the facility management department, housekeeping, security services, billing, and cashier department. Then another category of hospital department and services, you have the administrative support departments. Examples will be quality and patient safety department, material management department, human resource, business development, and finance and accounting department. Other departments and services can be created by the administration, hospital administration, on the basis of needs, okay, as deemed by the management. Thus, roughly, a hospital can have a minimum of 25 departments, okay, this is just an approximation, and services. The number could be more. It may be up to 50 departments and services, or even more, depending on the situation. This slide illustrates the importance of alignment, coordination, collaboration, and integration of all the departments and services to effectively and efficiently achieve performance excellence of a hospital. Let's now focus our discussion on the department. Just as the hospital is made up of different interrelated parts, in terms of the departments and services, to facilitate achievement of its corporate goals, this is the hospital-wide goals, Then each department and services is also made up of different interrelated parts to facilitate the achievement of its authorized functions and services, this time within the department. Okay. Each department and service is also considered as a system in a hospital. The hospital can be called the super system, and the departments and the services within the hospital can be called the subsystems. Each department and service must utilize systems perspective, approach, and thinking the management as in the whole hospital. That is, understanding the system by examining the linkages and interactions between the components that comprise the entirety of the defined system, which is the department. Viewing and analyzing situations in the department holistically and comprehensively, and to always look at interaction of parts to other parts to the whole, and vice versa, with alignment and integration as key results areas and key performance indicators. Again, this is within the department. And not to say there must be alignment and integration, coordination, collaboration of each department and service with the whole hospital, as well as with other departments and services, because there are other departments and services in the entire hospital. This slides illustrates hospital departments as a system with interrelated parts, and with the hospital being the super system with various departments as subsystems, and the interfacing departments as cause systems. Each department is also a system by itself with interrelated parts or processes. When planning and when doing problem solving, all managers of the department should have a perspective and analysis thinking that look at the parts simultaneously with the whole at the whole, or vice versa, and vice versa. And this approach should be holistic and comprehensive and systematic, using the input, output, and throughput processes that consider the external and internal environment. The key result areas of the system perspective and thinking should be alignment and integration of all the subsystems or parts toward achievement of the department's vision, mission, goals, and objectives, and eventually of the hospital's visions, mission, goals, and objectives. This slide shows the essential and basic components of a department, which must be present to facilitate accomplishment of its authorized function and services and achievement of its goals. Okay. So these are the various components. There are about 22, 23 of them. Okay. Number one is the leadership. Number two, authorized functions. Number three, authorized services. Then on the output side, you have the goals here. Then in the throughput, you have the architectural design, engineering and constructions, physical structure, DOH licensing and structural requirements, policies and procedures, risk management system, human resource program, equipment and material program, data document and records program, business development program, budget program, IT-enabled system, and then lastly, the regular performance evaluation and continual improvement program. And all of these components must be present. That's the first requirement. And then they should be aligned and integrated with each other in order to achieve performance excellence for the department. On the extreme left of the slides here, one sees the need for alignment and integration with the whole hospital, as well as the other departments in the hospital. So this slide illustrates the super system, which is the hospital, and subsystem, which is a particular department, and cause system, which is an interfacing department. The arrows that you see here among the different boxes indicate the need for alignment and integration of all the parts of the system, which is we're talking about the department now, with the super system, which is the hospital, and co-system, which is the interfacing departments. At this point, I'd like to disclose that this department design and development framework or administrative design was developed by yours truly in 2010 to facilitate learning, planning, and administration, which I still find it's applicable up to now. This department design and development framework is applicable to all kinds of departments and services in the hospital, such as the emergency room, surgery departments, operating room, housekeeping departments, etc. To fully develop this framework, there must be a manual that contains description, elements, and management system of each box, the so-called design and development blueprint. So there are about 22 boxes here. After the design and development blueprint, there must be evidence of implementation and evaluation of the results of the implementation. So here comes the relevance of this regular performance evaluation and continual improvement program. I shall now discuss the hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. On the extreme left of the framework here, there are 4 boxes that refer to the hospital and interfacing departments. So whatever be the department, the administrative design and development program should be aligned and integrated with the whole hospital concept and design, governance, policies and procedure of the entire hospital, operations, policies and procedures in the hospitals, as well as the interfacing units, other departments, operations, policies, and procedures. In other words, there must be a systems perspective or systems thinking. Let's go to the box of the leadership. Whatever be the department, there must be a competent head with at least the following competencies. So that competent head must have the unit technical requirements, competency in the specialty of the department, hospital teamship, meaning team playership, and then managerial skills and leadership skills. There must be at least a job description, job specifications, and performance evaluation system of the leaders and managers. As to functions, the second is the other box here, there must be a document stating the authorized function of the units. It must be complete and clear with general and specific functions in it, and it must be authorized by the higher office. As to the service box, there must be a document stating the authorized services of the units. Services offered and functions authorized must be congruent with each other. Now, going to the output, the goals, there must be a document stating the ultimate goals which must be aligned and integrated with the goals of the bigger system, which is the hospital. The basic and essential goals are the following. Basically, when I say basic and essential, these are practically present in all the hospitals. So you have performance excellence, client engagement, quality and safe healthcare services, cost-efficient or value-based services, and then maximal utilization of whatever services are being offered. So you can see all these goals present in all the hospital. All these goals should be eventually be contributing to the financial viability and sustainability, not only of the department, but also of the entire hospital. This slide shows the basic processes of management in the department design and development framework. So you have the input here, which consists of the leadership, functions, and services, and the throughput, all the boxes in between the input and the output. The output are the goals, is the goals. Now, as to the box on DOH licensing and structural requirements, or the Ministry of Health in other countries. So this means that there must be compliance to the local government, national Ministry of Health or Department of Health guidelines in the planning and design of a hospital and other health facilities. There should be one, okay? There are publications on this issued by the Department of Health or Ministry of Health, and there must be also some guidelines on the safe hospital initiatives, okay, which include structural, non-structural, and functional indicators, building code, fire code, local government requirements, etc. As to the physical structure, this refers to the geographical space or area in the hospital to construct a department to receive patient clients as well as physician clients requesting for services, and to house the staff who will perform the functions of the department. The service requirement as dictated by the authorized function is the first determinant of the physical structure of a department. The other determinants of the physical structure are the following: statutory or regulatory requirements of the country or all the local government, if there are, okay? And then DOH licensing requirements of the Ministry of Health. So you have the guidelines on the planning and design of a hospital and other health facilities, safe hospital initiatives, etc. And then the specialty requirements, particularly on the training and research needs, like then other requirements will be, determinants will be the human resource program, equipment material program, data, document, records program, budget program, risk management program, risk development program. And other determinants are the quality standards, community expectations, efficiency, caseload, and of course, probably the most important is the honors one. So there are various determinants of the physical structure. Architectural design and engineering and construction, this will be dictated by the Ministry of Health or Department of Health licensing and structural requirements and the physical structure requirements. There are usually a prescription of the minimum requirements, but try to achieve the minimum requirement and you can go beyond it without violating the basic essential requirements of the respective Ministry of Health or Department of Health. As to the human resource program, there must be a document showing the job description, job specification, and performance evaluation system of the human resource or the staff or the personnel in the department. There must be documentation of the adequacy in number and competency in managing and running the hospital. The department, I mean. As to the equipment and material program, there must be documents showing adequacy of the equipment and materials needed to facilitate an effective and efficient functioning of the department in consideration of the key functions and services of the unit, the statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. As to data and records documents program, there must be a document again showing the adequacy of the data, document, and records needed to facilitate an effective, efficient functioning of the department in consideration of the key functions and services. Note that the main guide here will be the key functions and services of the department, then the statutory and regulatory requirements, other objectives like business development, risk management, and IT-enabled system. As to the business development program, there must be documents showing the presence of a structured and comprehensive program that will develop the business of the department or unit to make it viable and sustainable. Budget program, showing a budget that projects the future income and expenses of the unit, and the budget that is being used as a guide for day-to-day performance and financial evaluation at periodic or planned intervals. Risk management program, there must be documents showing the risk management program, which is a planned and systematic process program to reduce and or eliminate the probability of a risk that usually results in injuries, losses, and legal suits. But it can also include risk with potential positive effect like improving the business and client engagement. IT-enabled system, there must be a document showing the use of IT, one, to promote efficiency in performance of the functions and accomplishment of services, to manage information of the unit such as getting, storing, protecting, processing, transmitting as necessary, and also later on retrieving as necessary. And also to create interconnection with other units in the hospital for timely communication, coordination, and collaboration in accomplishment of the services of the department or the unit, and to communicate with the patient and also the physician clients, both inside and outside of the hospital. Now, as to policies and procedures, clinical practice guidelines, and clinical pathways, again, there must be documented policies and procedures, clinical practice guidelines, and clinical pathways that serve, number one, to provide order, systematic way of doing things, to promote standardization, to facilitate communication, to promote effectiveness and efficiency, and to provide a guide to present and future staff, among other things. And these policies and procedures must be aligned with the policies and procedures of the hospital, meaning the policies and procedures of the department must be aligned with those of the hospital, and they should be reviewed and revised periodically. Clinical practice guidelines and clinical pathways are akin to the policies and procedures, but focus more on patient management. So when we talk about clinical practice guideline, the usual definition is that it is a systematically developed statements built on synthesis of evidence, which provide formal recommendation, take note of the word recommendation, about appropriate and necessary care intended to assist practitioner, the physician staff, and patient also, to make decision about appropriate health care for specific clinical circumstances. And clinical pathways, to differentiate it from the clinical practice guideline, this is an interdisciplinary, meaning involving more than one department's interdisciplinary plan of care that outlines the optimal sequencing and timing of intervention by the different players in the hospital. Okay. And expected outcomes for the patients with a particular diagnosis, procedures, or symptoms. The last box is the regular performance evaluation and continual improvement program. There must be a document that shows a program to appraise the extent of accomplishment of the department in its authorized functions and business plans at planned intervals, which can be done quarterly, biannually, or annually, and to determine the areas of improvement and then act on them. Let's now go to the last learning objective, which is the common challenges encountered in governance of departments together with their suggested strategic solutions. The challenges can be in at least 5 categories: man, system and methods, machines and equipment, money and other resources, trends in hospital industry, healthcare, and medical sciences. The under-demand category are this involve the consultants, the residents. These are the physician consultants, the residents, and the other colleagues in other units. This will also include the chief of hospital and other bosses in the hospitals, and the subordinates as well. The common problems are, number one, competencies, number two, quantity, and then very challenging one is the integration, coordination, collaboration, integration among the different man. And then, of course, personality, which is not easy to change. Okay. So suggested strategies consist of leadership and managership skills, managing your boss, meaning managing his personality, adjust accordingly to his mindset and mood. Okay, that's one strategy that somebody can use. The use of multi-sectoral, multi-professional committee membership. Again, this is to promote alignment, collaboration, coordination, and integration. Under the systems and methods category, common problems are the lack of systematization in doing things, the lack of standardized procedure. Suggested strategies, because it's hard to make manuals on this, make use of the Ministry of Health or Department of Health licensing requirements as a guide at the start, then use the quality standards as a guide, such as the PhilHealth Bench Book, Joint Commission International, Accreditation Canada, and other international standards that you can take hold of. But the more common standards being used in the Philippines are you have the PhilHealth, this is derived from the international ones with some modification for EC applicability. So they usually come from Joint Commission International and Accreditation Canada International. And then the last one will be suggested strategy is to establish policies and procedures, clinical practice guidelines, and clinical pathways. Under the machine and equipment categories, common problems are the lack of a management system to describe how to manage this machine, lack of calibration and preventive maintenance of machines and equipment. Suggested strategies will be policies and procedures to spell out the management system, which will include the frequency and the accuracy of calibration, the quality, and also the presence of preventive maintenance. Under money and other resources, the usual problem, the perennial problem is limited resources, which is always a problem. Suggested strategies will be just to rely on the leadership of the department as well as the hospital director, managing your boss, and then some innovation on how to get the necessary resources. Under the trends in the hospital industry, healthcare and medical sciences and category, the most common problem here that we encounter, especially during the past 10 to 15 years, is the rapid changes in trends which oftentimes are difficult to cope. Suggested strategies would be to come out with a knowledge management system in which there's a constant tracking and continual education, tracking of new changes, and then educating your staff, then benchmarking, and then being innovative in trying to keep up with the trend. I'd like to end my lecture by flashing again the topics that I have covered. At the end of the session, understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Understand the importance of alignment and integration in managing a hospital and its departments. Describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements. And of course, the last one would be the common challenges encountered in the governance of the department, together with their suggested strategic solutions. How to run and manage a department effectively, efficiently by systematically using the system perspective approach and systems thinking. Okay. So just try to remember these slides that illustrates the hospital and the departments as subsystems with the interrelated parts, and the hospital being the super system, and the interfacing department as co-system. Each department is also a system by itself with interrelated parts or processes. So when planning and when doing the problem solving, decision making, all managers should always have a perspective on and analytical thinking that look at the parts simultaneously at the whole and vice versa. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external and internal environment. So the key results area of the system approach and thinking should be alignment and integration of all the subsystems or parts towards achievement of a department, vision, mission, goals, objectives, and eventually, don't forget the hospital's vision, mission, goals, and objectives. As to the importance of alignment integration, just remember this slide showing the pictorial differences between alignment and integration and steps towards a mature process approach. So the ultimate target is integration. Number 4, we'll try to align everything, and then after that, integrate all the parts of the processes. Now, as to the last learning okay, try to also remember these slides. This illustrates the importance of alignment, coordination, collaboration, integrations of all the departments or services to effectively and efficiently achieve performance excellence of a hospital. Alignment, collaboration of all different parts, and then integration, trying to achieve performance excellence in terms of the vision, mission, goals, directions, projects. How to apply it? Using this framework. So try to remember this framework. This is applicable to all the different departments. So it's quite comprehensive. It facilitates learning and planning and governance of a department. You just have to put in the details in each boxes, the contents, and then compile them into a manual. And then make sure to implement and then review the manual as you go along. And then for the last objective, learning objective, just remember this starting table with the 5 categories: man, systems and methods, machines and equipment, money and trends. And recall the common problems under each category and my suggested strategies. You can add more as needed, but based on your situations and your settings, particularly on the strategies, it's really up to you. I just gave you the basic, the more essential ones. So with that, I'm done with my lecture. I really hope you have acquired the learning objectives through my presentations. Thank you for your kind attentions. I'm now ready to answer any questions that you may have.
Okay. So thank you very much, Dr. Hoson. Any question from the class? You may
Hi, sir.
How
use
many are
the
international students here?
we have some Gayatri, we have Navin, Dr. Navin. Yes, Dr. Navin, you have a question?
I'm just indicating I'm an international student.
Oh, okay. You're just indicating. Although I
Okay.
think someone
From
tried
where are
to.
you? From where are you?
I'm
Which
from
country?
Malaysia.
Okay.
Yeah.
All the other international students are from Malaysia.
Yes, I believe so.
Okay. So you
Mm.
call your department as Ministry of Health, right?
Yeah, the health is under the Ministry of Health. Of course, we have
Okay.
departments which is in the state level.
Okay. So here we call it Department of Health. In Malaysia, you call it Ministry of Health.
Yes, sir.
Okay.
Okay, so I do believe Dr. Gorospe was raising his hand earlier.
Um,
Yeah.
Hi, sir.
Hi.
Dr. Wilson. I'd just like to ask, because sometimes we experience departmental problems in our department. Sometimes we're cause of, for example, there are delays in the services. For example, how would I differentiate this from a departmental problem than a systemic problem? Or
Is it
can it be a systemic problem? How do I, would make me, what would indicate this as a systemic problem or a departmental problem instead?
Well, first of all, you have to make an analysis of the causes, no? Okay. And then see whether I'm sure there will be involvement of both the department level as well as outside the department, no? So try to identify what are the causes of delay within the department as well as outside, no? So try to solve the problems inside the department. And then, of course, I'm sure most of the time there are problems outside also, because it's really hard to run a whole department. There must be full integration now, which is practically, I can say, impossible to achieve completely, but try your best. Then talk to the other departments for possible solutions. No, okay.
There must be a problem solution tree. What we
Yeah,
have learned from Dr. Silent before.
yeah. Try to do it on your own first, but don't. Of course, you have to concentrate on your own first, the home base, and then. But usually, from my experience, there's also a lot of problems contributed from the outside your department. So you really have to talk to them. Then try to come out. If you have a hospital-wide quality management system. If you
Mhm.
have, you can bring it up there, and then they can come out with a comprehensive solution that will involve all the members, all the different departments. No? Okay.
Thank you, Prof.
Try your best. Try your best.
Okay, I think we have a question from the chat, but it was directly messaged to me. Hi, Sir Patrick. My question po, this is from Dr. CT. Okay. My question po is course, oh, sorry, it's course related. I'm sorry. So it's not about the topic. Okay. I did not
Okay.
read it ahead. Sorry about that. All right. So are there other questions from the class?
Any problems that you want to contribute to the list of my the 5 challenges?
I think Dr. Anisa has something to share or something to ask.
Okay.
Hey, sir. Good morning. I have something to ask lang po. Hey, Dr.
Where are
Hosan.
you?
Oh,
Wait.
sorry. I would have internet connection problem po kasi if I turn on my camera.
Okay, Anisha. Okay.
Yes po.
So
Yes po.
yeah.
I would like to ask, sir, how would you deal with, if, for example, sir, there's problem with the referral system in the department, and um, the other department involved is not actively coordinating with the new referral system or with the new policy that you are trying to implement. How would you deal with that not very cooperative department?
Can you come out with a specific problem? Example.
Like, for example po, sa medicine, Department of Medicine,
Okay.
there's a policy regarding logging, writing the referral sa logbook referral.
Referral to referral to whom?
Medicine referring to surgery.
Okay.
And then just to document the time of referral, ganun po. But the other department would not write po sa logbook. Parang ganun po. The other resident in that other department.
So you require them to write in a logbook as to the time that they see the patient.
I don't know. For example, sir, surgery would refer to medicine, and
Okay.
then we are requiring them to write sa referral logbook para ma-document yung referral, but
Okay.
the resident would not log it po doon sa logbook.
Okay. So, okay. May I ask, you are in the Department of Medicine.
Yes po.
Okay. So surgery is referring a patient to you for probably clearance, whatever, no?
Yes po.
So,
Opo.
so your policy is that you want them to log in the time, the date of referral to your
Yes po.
department, no?
Yes
Because
po.
you want to keep track of the what do you call that? The running time, the time that you will be able to answer the referral. You want to keep track. Probably you have a policy that you will answer the referral within 24 hours. Sorts of such example, it will be that if you have a quality management. So, but
Yes.
you have to tell them, please log in your time. If they don't want to log in, so at, probably until you can talk to the head of the Department of Surgery, you can probably do it on your own. Now, when they come in, you just make a temporary measure to put in the time, no? And then after that, talk it over with the Department of Surgery. Please try to log in the time that you refer patient to us. Or you probably must have a logbook now when they come, when they submit the referrals, no, there's a time for that, no, noted time and also the date, right? Okay. So if they don't comply with that, number one, you have to talk to the department heads of the Department of Surgery, no?
Thank you, sir.
Okay. So as I said, there are a lot of problems, no? So does that problem that the problem will involve man, right? Man, and also the probably the systems, you know. If you look at my category of common problems, you have the man, the systems, and methods, no? So so you have the man problem, people are complying, no? So the other problem is the systems, no? Probably there's no hospital-wide system yet. You're trying to make something to improve on the system, but you need the cooperation, collaboration of the other departments, no? Okay. Okay.
Sir, I
So
have a follow-up question.
any other additions to problems that I mentioned, 5 categories?
I could. Morning, Prof.
Go
Again.
ahead. Go ahead.
Just a follow-up question to what was cited by Dr. Anisa. Because sometimes I also feel when I was the chair of the department, I let my subordinates handle the problem first before they bring it up to me. So as a leader or of a hospital now, at what point should a hospital leader at what point should hospital leadership intervene versus allowing departmental autonomy? Like for example, what happened with the case of Dr. Anisa? When can the medical center chief intervene with regards to departmental problem? Should
It all depends on the urgency of the situation, the extensiveness of the situation. Yeah. In this particular case, Alonso, probably you can easily solve it by talking to the chairman, no, because this is an interdepartment concern, no. But if it's a smaller problem, less than that, you can talk to the residents, no. Okay. So it all depends. Okay. Martin?
yes, Prof.
I'll give you an example in which you have to talk, you have to let the subordinate answer settle the issue.
Like for example, I was thinking if this problem has a big impact to the whole department, that is probably the time I would intervene with the problem
Yeah,
unless
correct,
and they cannot
correct.
solve it.
Uh-huh.
So I allow them to solve their problem before they bring it up to me if they cannot come up with the proper solution to the problem that they have.
Okay, so that's correct. But give me an example that you can let the subordinate handle it.
Like for example,
You're now talking about the chief. You're now a chief of hospital.
okay,
Okay.
if I'm the chief of the hospital, problem with the scheduling, like for example, between departments, I would probably look into the system that what we have regarding referral systems, and then if there is miscommunication or any problem by not following the process that they presented from their department regarding referral, then I would probably interfere if there is no hindi na solution yung problem. There is still continuous disagreement between the two departments.
Correct, correct. So if you're, it depends on what position you're sitting in. No? Let's say you're the chief of
Yes.
hospital. So you have Department of Surgery and Internal Medicine Department. There's an issue there on the logging in of the time of referral. You can ask them to settle it on their own first. No? But if you are the department, Dr. Alonto is a department head now. Okay, you are the department hospital head now. So probably she can probably talk to right. You want the resident to settle it among themselves, or you just talk to the department head of surgery. No? So that you can settle the issue right away. No, it's I think it's really not a big problem, right? Just logging in the time. So it all depends on the type of problems that you're handling. It can be let them do it first. The subordinates try to settle their problems. No, then if they cannot, it's really up to you. You want to come in, you come in. No? Okay. So
Thank
as
you,
a
Prof.
rule, as much as possible, give them the chance to settle it among themselves so that there will be collaboration, cooperation, no, good interpersonal relationship among the different departments. No? Okay. But ready to
Thank you.
come in anytime. Okay. Any
Okay.
more?
Okay, so thank you very much. I do believe Dr. Yao raised her hand first. Sorry about that. I will call you later, Dr. CT. So, Dr. Yao, can you ask your question?
Yes, good morning. I really enjoyed your lecture, sir. So, for my question is, as a new administrator, so I was appointed last year as ancillary director of a private hospital. As a as a new administrator without any prior experience in administration, what should be my top three priorities to focus on? Because it seems like I'm always troubleshooting, always reactive rather than proactive. Also, as a new administrator, how can I introduce like changes without creating resistance, especially because most of my section chiefs are senior uh, to me.
So when you say allied medical, what do you call this? Allied medical services department?
Bali, sir, I'm ancillary director. Yeah, of so I'm the under me are 7 sections: cardiology, pulmo, pharmacy, laboratory, radiology, rehab. That's the last. I forgot the other one. There's seven.
So many, no? So many.
Yes, so many. And
So
there are
can you
so many.
classify them? Can you classify your departments into one is a treatment department, the other one, the others.
Mostly diagnostic. But
Okay.
pulmo has treatment. Yeah, pulmonary has nebulization, so there's treatment, and rehab also. Pharmacy. And then the
Okay.
others are dietary. And then the others are all diagnostic.
Okay.
And then,
So mainly diagnostic. Okay.
yes,
Mainly diagnostic. Because
mainly,
the title is ancillary director. Okay.
yes.
Mainly diagnostic. So I would suggest that if I were the one, okay, you're just newly appointed directoress, no? So there's an urgency for you to act as soon as possible. But if you want to, at the same time, you can do some measures that will establish a good foundation. When I say good foundation, one that will last for a long time, no? Okay. I think you can, if you believe in my framework, no, you try to review the department design and framework and ask them to come out with some initially just a quick draft lang because not easy to come out with the details of the 22 boxes, no. Okay. Ask them to come out with a draft on what should be contained in each of the boxes, no. Okay. And then
Mm.
probably slowly take your time. If there's you can afford some time, then ask them to discuss. Let's example leadership, no? Example budget, no? Then try to get them together and then make some alignment in all the policies and procedures. No? Okay. Because for the 7 departments that you are handling, no, the framework that I gave you, it's applicable to all of them. No? So they can try to fill up, let's say, for leadership, what do they expect? No? Then you can get some input from the other departments and then put in your input, no? And then come out with the policies on that, no? Then, of course, in the end, you have to also coordinate with other directors of the hospital now outside your ancillary department, no? Okay, to make it align, no? But if you're in a hurry because you're appointed, you just identify the urgent problems that you have at the moment. Example will be what? I don't think errors in diagnostic reports is an urgent problem. It
Actually,
could be
some of our policies are outdated and not guidelines based. So that was my first memo to my section chiefs, is to at least review policies annually.
very good. Okay.
Mm.
So that's a common problem among hospitals in the Philippines. I don't know in other countries. I don't know in Malaysia. Okay. A lot of times they don't, up to now, they still don't have a formal policy statement on policies and procedures. But if they have, they're not being reviewed. Let's say it should be reviewed at least once every 3 years at the minimum.
Mm.
No?
Mm.
Okay. So, but most of the time, it's not being reviewed for the past 10 years, 20 years, etc. No? So if you have taken that step, ask them to review the policies and procedures, and then you can, because you're now taking this course, now if you believe in my framework,
Yes.
you can ask them to come out with something that will be aligned with the framework that I presented to you. No? My framework is actually not very. I don't dictate anything. It's a process. No. So in those boxes, you just come out with the policies and procedures. Whatever specific policies and procedures that you will come out with, it all depends on your situations, on your local hospital situations. No. Okay. But just agree on those policies and procedures as among the 7 directors that you have. No. Okay.
Thank
So
you.
policies and procedures. So try to develop it. So, but what is your urgent problem nowadays at this point in
Um,
time?
I think right now my urgent problem is the rehab department because of the declining census. Um,
Okay.
yeah,
So business. Okay. So
yeah.
that's a part of the business. How about patient
Mm.
care? Any
Um, with regards to patient care, there was just one issue with when there was a increase in census of intubated patients that we had to outsource mechanical ventilator outside, and then there was no policy regarding outsourced ventilators. So what happened was the 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 patient had to pay more because they had to shoulder the rental fee, almost double what would have been the cost if the mechanical ventilator was in-house. So that one, I already proposed a solution to the finance department to have no parang standard fee for all, regardless of it being in-house or rented, by just adding a little fee, like additional 200 that will be applied to all, so that it would cover the rental costs in case of surges.
Oh,
Yeah, I think, but the yeah, uh,
okay.
and then
So you're
always
asking,
there.
uh,
Yes,
you're asking me for your earlier request was for
yes,
three
three.
proposals.
3.
So I would suggest you
Oh,
attack it
3.
at the same simultaneously, because you're now the head of a big. Actually, this is a big task for you. Handling 7 departments, clinical departments, no, usually diagnostic, no. So you try to tackle it by looking at the long-term program, long-term that will promote quality care, that will improve the
Mhm.
hospital revenue as well as your department revenue. Now, but it will take some time to establish that foundation. But start it now, no,
Mhm.
and then at the same time look at the uh, urgent problems that you're facing now. No, example, the ventilator, let's say um, the income, rehab is not
Mhm.
getting enough income. Now you can attack that problem right away. No, but have in mind the long-term quality care that you're going to implement in the probably next year, 2 years from now. No, okay, something that will be long-term and sustainable. No, okay. You have problems also diagnostic. So diagnostic, you have problems in uh, results of the test, how long it take. Is
Another
that
problem with this, yung
is that causing patients dissatisfaction?
in certain like in our histopath,
Mm.
the turnaround time is too long, more than
Oo.
2 weeks, so that the census of histopath is very low because even our own doctors, our own surgeons do not send specimen.
Yeah, so you
Yeah,
try to
they send it
analyze that.
out. Yes.
Okay. So that will affect the revenue of your of
Mm.
of the laboratory. No? So you
Yes.
try to
Mm.
analyze it right away. Is it the too long or the long returning turning time, or the cost? Sometimes also the cost. No? Okay. So in short, try to target both the long term and then the immediate urgent solution problems that you have at the moment. No? But when you try to tackle the immediate problems now, so use the system approach and then use the long-term plans that you have, the ideal plans, the policies, procedures for your department. No? Okay?
Okay. Thank you. Thank you, sir.
You're welcome.
Okay, thank you very much. I believe Dr. CT was also raising her hand, but now the hand is, she removed the reaction. Dr. CT, do you still want to ask your question?
Yes, sir.
Okay.
1 second. I'm just trying to turn off the
Okay.
camera. Hello, good morning,
Good morning.
Prof. Thank you, Prof, for your lecture. Sir, my question is more on I just want a system's perspective in a problem in a hospital where I work in. So I work in part-time in a public hospital at the ER setting. So this is about transitions po of patients in the ER. Probably this is not a problem for private patients because all patients coming to the ER are accepted as patients of the ER. But in a public hospital, since the patient load is very high, especially at the urgent part of the hospital, um, I'm looking, I want to ask if there is a way to actually create a pathway for those truly ambulatory patients who are not urgent, who doesn't need urgent management at that point because they because most of the patients that are ambulatory can actually be seen at the outpatient department instead of the ER. But since the ER is the most front-facing department of hospital, these patients come into the ER. And at the public hospital with a lot of patients already, they sometimes cause, they mostly cause crowd control problems, something like that. My question po is,
Nawala yung sound mo. Nawala. The sound.
Yeah, your audio was cut off. You're not muted,
my,
but hello?
hello
Hello.
po.
Okay,
Hello.
Okay.
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 Your question
It's back.
is,
It's
okay.
back. It's back.
Sorry,
Can
sir.
you start from the beginning of your question? The question
The
itself.
question
So
is,
my questions, sir, is about transitions of patients. So patients, some patients kasi they tend to come to the ER despite the urgency of their problem. Like for instance, there are patients who are actually better to be seen in the OPD setting instead of the ER. So these are non-urgent patients, like ambulatory patients. No? So the practice is before that our triage system in the ER can ask patient to go instead to the OPD instead of the ER because the ER is, for instance, overcrowded already, or so they ask the patient to go to the OPD. However, during this transition, some patients actually deteriorates. So the patients, no? So the reaction of the hospital is to say, oh, direct the patients at the OPD. You should accept all patients. So you should see even if it's non-urgent or urgent. My question, sir, is this in a systems perspective, is this a sound policy? Or is it better for a hospital to create a pathway where safe referral or transitions of these patients can be done from the ER to the OPD, like to create a pathway? Or is it more sound that the ER accepts all these patients?
okay. Okay. I'm aware of your problems. No, that's problems in practically all government hospitals. No. But let me point out to you when you talk about systems perspective, it's not you make a system perspective not because you're thinking of a protocol. There's a protocol that will apply the system perspective. Uh, you make a protocol on your own based on your hospital setting using the system perspective. That's what I want to point out now. Okay. You may you may look at you can benchmark with other government hospital, but you start first with analyzing your own situations in the hospital, okay? Because you have a unique situation now. Okay. So what are the departments that can handle all those plenty ER so-called emergency patients? No? Okay. Do you have enough resources to come out with the urgent care service? Okay, you can probably put a small policies that only emergency patients will be seen in the emergency room, and then urgent care probably not the crucial one can be looked at another department. No, okay. So if you have the capability, do it. No? Okay, so that will be systems perspective. And then you have to ask the cooperations of the other departments. And of course, you have to consider your financial your resources also. No? Okay. Then, okay, that's what I want to bring out. Try to analyze first your situation there. no? And then come out with a solution using system perspective, meaning you analyze the entire hospital, the department, it's the emergency room, then come out with a solution, no? Your own unique solution. It doesn't have to be the same as PGH or other hospitals, no? Okay. Now, if you can try to benchmark and get some idea from other hospitals, but create your own policies and procedures there. No? Okay.
Yes, sir. Thank you, sir. Sir, I think if I will reflect it with the how the PGH do it, is that they have an ambulatory care, right?
Yeah.
So all the
Yeah.
patients that come into the ER who are actually more like OPD, they go to the ambulatory care. However, what you were saying, sir, if you are in a hospital which is not capable of doing this like a midway between ER and an OPD, you create an urgent care or an ambulatory care unit, but
Yeah.
um, it should depend on your hospital capability or human resources as well.
Yeah.
Um, yes, sir. So if you are not capable of you creating that unit as a
Look,
midway,
look for other solutions.
look for others.
Okay.
Yes, sir.
Example,
Because
are there other government nearby hospitals?
yes, sir.
You can try to establish a memorandum of agreement. No? Can we work together? Can we transfer patients to you if you're not having a lot of patients there? No? Can we transfer patients to your hospital? Now, if there's a problem in the personnel, is your hospital willing to help them also? Probably example. This is just an example, no? Coming out from the box, you can probably assign one of your staff there to help them because they have the physical facilities, no, but no patient, not crowded patients, no, not the capacity is still you can still they can still admit patients. You can probably send some of your staff there to help them. No? Parang extension, but there must be a memorandum of agreement, something
Yes,
like
sir.
that. No? Okay. So create your own
Okay.
solutions using system perspective, looking at your own hospitals. And then after that, you look at the surrounding hospitals in your community. Of course, as I said, you can benchmark with other hospitals and then try to see if it's applicable to you, that you can get some input, some recommendations that you can use. No? Okay.
Thank you, sir. That's a good perspective.
Okay. Thank you also for your questions.
Sorry, I would also like to add something to that, sir, if you don't mind.
No, no, sure,
Yeah,
sure.
because I also give a lecture on systems thinking, but it's on a more general sense. That's how the lectures differ. But the way Dr. CT asked about systems perspective is as if it was an opinion that she was trying to ask. And I would just like to clarify that systems perspective in that sense, or systems thinking, the word thinking there is akin to strategic thinking, like that kind of thinking, in that it's a skill that you learned. So you it's not really, oh, what's your perspective on this? It's not that kind of perspective. It's basically the way you look at the complexity of a problem. So if you have a problem on the volume of patients coming into your emergency department, systems thinking would not say, oh, I'm a systems thinker, so this is what you do. Because what systems thinking does is basically give you the tools so that you can assess your own problem and appreciate the complexity of that problem, and then apply solutions based on evidence, but you need to monitor and evaluate that too, to see if it's effective for your systems, because uh, the complexity is there and the unpredictability of systems is also there. So we are equipping you here with the tools so that you can do this on your own. Now, in regards to your problem, I would like to bring up a solution that was thought up of our Malaysian counterparts. I think this is also the idea of Dr. Hoson's suggestion in asking about hospitals in your vicinity, because what they did was a clustering system wherein they were able to triage patients not just between departments of a hospital but between hospitals within the vicinity. So if your emergency department is full, for example, you can triage them in such a way that those that do not require urgent or emergent care can be triaged to nearby clinics that can handle those kinds of cases. So you can look into that, no, if it is appropriate for you based on your assessment of your own system. No, so that's what systems perspective is in this context. So yeah, sorry. That's
Okay.
my addition
Thank
to
you.
that.
Okay.
Okay, so are
Thank you,
there any more
sir.
questions from the class?
Any reactions, written reactions, City?
Yeah, sorry.
Yes, sir. I agree with Sir Patrick also, and thank you
Okay.
also, sir, for that. For putting back the frame of mind when you think
Mhm.
about health systems.
Yeah.
It's just a perspective. It's a way of thinking. It's not just like a protocol or a pathway, as Dr.
Mhm.
Hassan also said. Thank you.
Yeah.
Yes.
Okay. Thank you. Any more?
Any other questions from the class? Okay, so checking the chat, there are no new chat entries. Okay, so going once, going twice for the questions. All right. So thank you everyone for attending. And of course, thank you, Dr. Hoson, for sharing with us your knowledge and expertise on systems thinking in the context of hospitals and with focus on the departments within the hospital. Uh, it's always a pleasure. I would just like to remind the students the OLETE form, which will help Dr. Hoson and will also help you, is in our Google Classroom already. I shared the link there, so it is available. Please answer that as soon as you are able. I would also like you to remind the students that there is a learning log, and I updated that already to include the title of the session today so that you can select it and answer the learning log for today's session. Okay. Dr. CT, your question about the groupings, I will announce it to the class, no, so that everybody will be informed. Okay, I will check that first. Okay, so thank you very much.
How many
Uh,
students are there?
uh, Sorry, there
How many
are.
students?
Yeah, let me check on the actual number because what we have here might not be reflect the actual number. I have we have more students this time than last time.
Yeah. Around 17?
Let me check the actual number. HA2. So we
Anyway,
have 17 right now.
okay. So can we have a group picture taking so that I can also see the faces of the students?
Of course. Okay. I can hold on, let me just fix my window. So students, can you please show us your beautiful faces? Okay. Beautiful unisex. Okay. Please turn on your cameras. Okay.
Okay.
And give us your smiles. Okay. Three. Oh, we still have cameras being turned on. Okay. So 3, 2, 1, go. Okay. So thank you very much.
Okay.
I have taken the screenshot. Let me just readjust my window again. Okay, so thank you very much, everyone. This is not the only lecture we have with Dr. Hoson. So if you have other questions that you may want to ask, you can reserve it for that, or you can message me or send it to the group chat so that I can forward it to Dr. Hoson. And with that, I will formally dismiss the class. Again, thank you, everyone, and thank you, Dr. Hoson, for your
You're welcome.
lecture.
Okay.
Thank you.
Bye-bye.
Thank you,
Bye-bye.
Prof.
Take care, everyone.